Hello, my name's Jane Earle and I've been the Principal Podiatrist at ACT Podiatry for 15 years. One of the most common conditions that we see is plantar heel pain, and the most common cause of plantar heel pain is plantar fasciitis. The pain of plantar fasciitis classically manifests itself along the medial calcaneal tubercle, further across the heel, under the weight-bearing area of the heel, and also up into the arch. With my experience, patients typically respond well when they've got very acute pain to the use of strapping, and over the years I've found a very good strapping technique incorporates the use of a semi-compressed felt arch fill. Semi-compressed felt is something that's readily available to all podiatrists. So we cut out a piece of semi-compressed felt, we place it in the arch, and then, having checked the patient doesn't have any allergies to adhesive tapes, I'm going to use some zinc oxide tape, which I'm first going to apply firmly to the lateral border of the foot, round the heel, and then, whilst applying a slight supinatory force to the foot, I'm going to apply the tape all the way up to the first metatarsal phalangeal joint. I'm going to apply that nice and firmly through there, and then, preferably using a slightly thicker tape this time. If you haven't got the thicker tape, the thinner tape will suffice. I'm going to apply lateral to medial with a bit of force, nice and firmly, some more strapping. I'm going to continue this down the foot, overlapping each time by about 1/3. This will take about 5 pieces. Now, I generally find patients are able to keep this on for at least 5 days. If you advise them to try and keep it on and dry using a plastic bag over their foot, and then as and when it does get wet in the shower, if they just dry their foot normally with a towel, it'll gradually dry out, and they may even be able to keep it on for up to a week. This can provide a lot of relief for patients with acute pain. I've had patients experiencing a 70 to 80% improvement in their symptoms just after 5 days of treatment. So once we've done that, we get a final piece of the thin tape going round from the metatarsal head, firmly down the lateral border, and then back up through the middle. Trim off any excess. And then finally we use a bit of locking tape over the top, which will help avoid any bowstringing of the taping off the foot. Now, often patients, when you're doing this for patients, they're getting a lot of pain, and, well, obviously in pain, but also they're getting swelling in their foot. So you can back up the taping with a bit of tubular compression bandage, applying it carefully so you don't roll the strapping off the foot when you're doing so. And as well as giving a little bit of compression, this will also help to increase the longevity of the strapping. And there we have it, a nice technique for offloading the plantar fascia for the short-term relief of acute plantar fasciopathy. Thank you for listening.